Well, now it's time for Mission. My name is Odile Ofori, and going straight to the issues pertaining to Ada East, and over 800 residents of Toanikope in the Greater Accra region face the threat of losing several of their family members if a health facility is not sited on the island. Daniel Latte reports a head count at one location revealed over 12 families had lost relatives, a situation they believe could have been avoided should there have been a health facility.
We went to the remote islands of Ada. Residents had heard of our coming. It was obvious they had stories to tell us.
At least here we have to get some clinic at this area. Just about 2 weeks ago now, a snake bite, this is my small boy here. He nearly died. We are able to do some traditional medicine before the following day we transfer him to the hospital. The thing happened in the night.
Amu Anani did not only suffer from snake bite, he has lost both parents.
Hey, remove your foot, show the place. Yeah, that's the place where the snake bite for the guy.
Anani was ready to take us home to see her sister and 6 other siblings. As young as 18, Anani lives with his siblings alone. What happened to your parents? We asked.
They did that you're sick. So if we have a clinic, I'm sending it to a clinic, so we don't have clinic, so that's why she died. My father also, there's no clinic. That's why he died.
Then we asked by a show of hands those who have lost relatives because they could not get to a health facility on time. My younger brother was brought to this island sick, but because we did not have a clinic, he died.
My sister had some complications after birth, but we could not get her to the clinic on time, so she died.
My younger sister and my granddaughter got sick, but they died because there was no canoe to send us to the clinic.
We could not get a canoe to transport my sister Salome to the clinic, so she died, but the child is alive.
For some, successive governments have failed them.
We are also in Ghana, and it seems the government is not supporting us here in the community. They are able to support some people outside in the community. Other communities, we are just in the island here. Here is an island, and they don't bother us. Last only South Town MP came today during the voting time, where they are playing their politics, that they will be coming to the area.
They begged us to bring the problems we have witnessed to the doorstep of policymakers in Ghana. Residents of Toanikope may be sitting on the time bomb as access to health care is non-existent. Daniel Latte, TV3 News.
Well, a beautiful story done by Daniel Latte. Well, we have a doctor here tonight to discuss the issues. In a case where governments and indeed communities have not been able to come up with chip compounds, among others, what could doctors be offering in terms of free services or indeed some philanthropy that they could do to help the situation? I have with me in the studio Dr. Nakowa Edu, and then she works with the Dansoman Polyclinic and then with an NGO called the Health Loop. Nah, good evening.
Good evening.
Well, in situations like this, we all know that doctors can't be everywhere because of numbers. Exactly what do doctors like yourself do for communities like this?
Well, looking at the documentary, one key thing kept running through, and that's the reality on the ground. equity, accessibility, and poverty. I mean, those really play a role in healthcare delivery. And as doctors, I mean, looking at the current state of healthcare in Ghana, the doctor-patient ratio is an issue. But what we can do and what we have started doing is to reach out through philanthropic missions to such areas, because till the time where a health facility could be present there physically, these are some of the things that could bridge the gap. Because if someone is taken ill, the person getting access to health care in time is an issue. But if we keep doing these missions on regular basis, reaching out to such unreached areas, we'll give them the options, and then also even prevent these things from happening, because preventive health really saves lives. If we go on these missions, sometimes we give, most of the time as part of the package, there's a screening session, and then there are health education parts. And health education is key because it promotes behavioral changes. It also helps people to make the right choices, because sometimes, you know, in the documentary, a point was raised about maternal health issues. If the people are prepared early enough, they could move closer to a health facility before the time. Well, maybe make arrangements in the meantime. But on the field, we can, at the time we go there, try to pick out danger signs and then help these people out. So
well, that leads to the second issue. When you go to communities like this, exactly what are the recurrent issues that come up?
Well, maternal health issues do come up. You may pick people with various risk factors. That's what we place them. And then we can act quickly by helping them get to the nearest service and get care. And then also we pick up malaria, HIV screening, we do that. We also pick up the emerging chronic diseases.
Tell me the challenges that you go through while doing some of these outreach programs.
Key among the challenges is, of course, funds, because we can provide the best that we can, our professional skills and knowledge. When we go in, we go as a team as much as possible. So we have pharmacists, we have lab technicians, nurses, doctors, of all fields and specialities. But then to get the health care services available, we need logistics, we need to send some supplies so that we can provide on-site treatment in certain cases, and then also medications that the patients will need. And sometimes we have to go through a lot to get these things. Social support from companies, drugs from pharmaceutical companies, you name them. So these are challenges really, because you have to go through a lot to make a case, but these things are really needed.
Which community are you, for instance, moving next? I'm sure one day you would go to this community to help once you've seen this documentary.
We'll be going to Esuchari. It's actually not it's part of Accra, but it's in the outskirts. It's in the Damgbe West district, one of the biggest districts in Greater Accra. That's Dodowa, Akosumbo Road. And at that time, when we visit them, we hope to do all these things, because when we go there, we go as a team with dental specialists, everything, and then I do everything that the people need. And hopefully we would try to go to this community, because it's amazing that they are part of Greater Accra and yet they don't have access. So we're not mentioning up there in the north or anywhere that's so far, but even in Greater Accra there are issues.
Yeah. Well, that's it for tonight. I am so hopeful and so sure that people living in Toanikope one day will get some of these free services coming from doctors that have put themselves together. Indeed, several more doctors and nurses, amongst other people, could come together to give good services and a worthy cause like this. My name is Odilio Fori. I was in here with Dr. Nakoa with the Health Loop, and indeed she also works with the Dansoman Polyclinic. Have a good night.